Magnetic resonance imaging, more commonly referred to as an MRI, is a non-invasive technology which produces three-dimensional, anatomical, detailed images of any part of the body. It is often used for disease detection, diagnosis, or treatment monitoring. Rather than using X-rays, MRIs use strong magnets to create a magnetic field, low-energy radio waves, and a computer to display the scanned images. The magnetic field causes the hydrogen atoms within the body to align in the same direction. Radio waves are then passed through the different parts of the body which are being scanned, forcing the hydrogen atoms to come out of alignment. These atoms then realign once the radio waves have been disabled, and as they do so, they produce radio signals which are transmitted to the radio antenna or receivers. The computer then receives this information and generates images. MRI is commonly used for providing high-quality images of the brain and the spine. Professionals primarily use this medical technology to examine knee injuries and other sporting injuries through clear scans to identify the problems associated with soft tissues such as muscles, tendons, and ligaments. MRIs are commonly applied when individuals develop irregularities that exist within the tissue or organs in their body. These issues allow medical experts to analyze the development or inheritance of strokes, musculoskeletal disorders, tumors, and other irregularities within the body. MRIs can also be utilized to determine the potential effects on the brain, lungs, and bones such as the pelvis, spinal cord, as well as joints by producing images that cannot be normally detected via X-rays, CAT scans, or ultrasounds to appropriately diagnose the issues affecting the individual.
Magnetic resonance imaging, as suggested by the name, is essentially a colossal magnet. Units known as Tesla is used when measuring the strength of magnetic fields. Majority of MRI scanners used in hospitals, medical research clinics, and other health facilities typically consist of a magnetic field of either 1.5 Tesla or 3 Tesla. To understand how powerful these fields are, the Earth's magnetic field is around 0.000006 Tesla, making a 3 Tesla MRI scanner around 60,000 times stronger. Magnetic fields and radio waves are used in MRI scanners to measure the quantity of water within body tissues, map the location of the water, and then using this information, generate an image which is projected on a computer. The human body consists of an average of 65% water, meaning there is much signal to measure, allowing for the generated images to be highly detailed. The hydrogen atoms of water molecules are used in the scanning process to measure the signal from the body. Magnetism is a property of matter that results from the orbiting electrons in atoms, which is used in MRI scanners. The orbiting electrons will cause the atoms to generate magnetic movement associated with an intrinsic angular momentum known as spin. Angular momentum is a form of inertia, reflecting the object's size, shape, mass, and rotational velocity. Spin is a quantum mechanical intrinsic property of elementary particles, which does not arise from more basic mechanisms. The property is one of the forms of angular momentum that interacts with electromagnetic fields, whereas classic angular momentum interacts with gravitational fields. Additionally, the magnitude of spin is quantized, meaning that it can only take on a limited set of discrete values. Precession also occurs throughout the scanning process. Precession is a trembling motion that occurs when a spinning object is the subject of an external force. Relevant to MRI, the proton of a hydrogen nucleus rotates around its axis, giving it spin. Through the proton's positive charge and its spin, a magnetic field is produced and receives a magnetic dipole moment, or MDM, parallel to the rotation axis. If placed in a magnetic field, the magnetic dipole moment will undergo precession about the direction of the magnetic field with an angular frequency. This frequency can be referred to as the Larmor frequency. The Larmor equation suggests the greater the field strength, the greater the frequency of the precession.
The benefits that an MRI scanner has over regular computer technology or other modalities is that it can be used to take images of the body in any direction and angle. The ability to obtain images on a wide variety of planes adds to the versatility and diagnostic utility. It also provides better soft tissue and can differentiate between fat, water, muscle, and other soft tissues. These images can provide information to physicians to allow for better diagnosis and discover a wide variety of diseases and conditions. MRI also does not utilize any ionizing radiation. Therefore, patients are not exposed to the harmful effects of ionizing radiation. Requires little patient preparation and is non-invasive. Provides excellent precision of anatomic structures from inherent high level of contrast resolution. On the other hand, the limitations of MRI machine include the attraction of anything metal, big or small items such as keys or oxygen tanks, creating a projectile which may damage the scanner. The radiofrequency energy during the scan could lead to overheating the machine. This process is only when exposed for long periods, such as the long MRI examinations. MRI equipment is also expensive to purchase, maintain, and operate. As well as machine limitations, there are many risks which can harm the patient, including the machine may produce loud knocking noises affecting the patient's ears and peripheral muscle or nerve stimulation if no ear protection is worn. The use of gadolinium-based contrast agents may produce side effects for the patients, creating allergic reactions. Claustrophobia can also be experienced by the patient as it is uncomfortably small. To produce quality images, patients must remain stationary, which may be difficult for small children and infants, which may need to be sedated or anesthetized for procedure, which may carry certain risks such as the difficulty of breathing and low blood pressure.
Conclusively, the benefits and limitations of MRIs in accordance with the rotational motion and magnetic field evidently demonstrates the expansive utility and extent of this technology as it has revolutionized and evolved from technologies such as X-rays through technological advancements, enhancing the ability to diagnose and identify problems associated with the body. Although MRIs display limitations relative to the patients or the equipment, these enhancements have reduced the harmful effects of radiation to patients whilst providing high-resolution images to accurately unveil and treat individuals suffering from internal complications within the body.